Are you aware that some common medications could be quietly harming your kidneys? Every day, millions rely on drugs for pain, high blood pressure, and infections, not knowing they may be risking kidney health. From over-the-counter painkillers to life-saving antibiotics and blood pressure medications, the stakes are higher than you might think. Could your medicine cabinet hold hidden dangers to your kidneys? Stay tuned as we reveal which medications to watch out for and how to use them safely, ensuring your kidneys stay healthy and functional. Kidneys play a crucial role in maintaining overall health by filtering waste and excess substances from the blood, regulating fluid levels, balancing electrolytes, and producing hormones that manage blood pressure and control the production of red blood cells. Because of these vital functions, maintaining kidney health is essential. Unfortunately, certain common medications, while beneficial for treating various ailments, can inadvertently cause harm to the kidneys. It is important for everyone, especially those regularly using medications, to understand how these drugs can impact kidney function and what steps can be taken to mitigate these effects. This video aims to shed light on several commonly used medications that could potentially lead to kidney damage, providing valuable information to help you safeguard your kidney health. While medications are designed to improve health and manage conditions, some commonly prescribed drugs can inadvertently harm the kidneys. The kidney's critical role in filtering and expelling waste makes them susceptible to damage from substances that can disrupt their function. This can happen either through direct toxicity or through complications arising from the body's response to these medications. For individuals who frequently use over-the-counter or prescription drugs, this risk underscores the importance of being aware of the potential side effects on kidney health. It is vital to understand which medications pose a risk and how to use them safely to prevent any long-term damage to these essential organs. This knowledge is crucial not only for those with existing kidney issues, but also for anyone concerned with maintaining optimal health. The primary goal of this video is to educate viewers about the potential risks associated with common medications and to provide guidance on how to use these drugs safely to avoid damaging the kidneys. By highlighting specific medications that are known to have nephrotoxic effects, we aim to foster a deeper understanding of how these substances interact with kidney function and what preventive measures can be taken to protect this vital organ. This includes discussing how to recognize early signs of kidney stress or damage, the importance of dosage control, and the necessity of regular medical checkups when using these medications. Our intention is not only to inform, but also to empower viewers with the knowledge they need to have informed discussions with their healthcare providers, ensuring they can manage their health effectively while minimizing risk to their kidneys. It's important to note that the information provided in this video is strictly for educational purposes. We aim to enhance awareness and understanding of how certain medications can affect kidney health, but this should not be taken as medical advice. Each individual's health situation is unique, and altering one's medication regimen can have significant implications. Therefore, we strongly encourage all viewers to consult with healthcare professionals, such as pharmacists, doctors, or nephrologists, before making any changes to their medications. These professionals can offer personalized advice based on your medical history and current health condition, ensuring that any adjustments to your medication are safe and appropriate for your specific needs. The kidneys are essential organs with several crucial functions, chief among them being the removal of waste products and excess substances from the blood. Through a complex filtration system, kidneys cleanse the blood of toxins and waste products that accumulate from the body's metabolism, ensuring these harmful substances are excreted via urine. This detoxification process is vital for maintaining overall health and preventing the buildup of toxins in the body. In addition to waste removal, the kidneys play a critical role in regulating blood pressure. They achieve this through a delicate balance of salt and water retention, and by producing a hormone called renin, which helps manage arterial contraction and blood volume. The ability of the kidneys to perform these tasks effectively is fundamental not only for cardiovascular health, but also for the proper functioning of various other systems within the body. Therefore, maintaining kidney health is crucial for ensuring the body operates smoothly and remains free from the toxic buildup that can cause a myriad of health issues. Several factors can impair kidney function, leading to a decrease in their efficiency and overall health complications. Dehydration is a primary concern, as it reduces the flow of blood to the kidneys. Without adequate water, the kidneys struggle to perform their critical function of filtering blood and eliminating toxins, which can lead to the accumulation of waste in the body. High blood pressure is another significant risk factor for kidney damage. It forces the kidneys to filter blood at a higher pressure, which can gradually strain and damage the delicate blood vessels within the organs. Over time, this can reduce the kidney's ability to cleanse the blood effectively, potentially leading to chronic kidney disease. Certain medications, especially when taken regularly or inappropriately, can also harm kidney function. Drugs such as non-steroidal anti-inflammatory drugs, NSAIDs, some antibiotics, and certain prescription medications can interfere with kidney function or cause direct damage to kidney tissues. This makes it crucial for individuals, particularly those on long-term medication regimes, to monitor their kidney health under the guidance of healthcare professionals. By managing these factors, ensuring adequate hydration, controlling blood pressure, and using medications judiciously, individuals can help preserve their kidney function and maintain overall health. Non-steroidal anti-inflammatory drugs, NSAIDs, are among the most commonly used medications for pain relief and inflammation control. Examples include widely recognized drugs such as ibuprofen and naproxen. These medications work by inhibiting enzymes involved in the production of inflammatory chemicals in the body, thus reducing pain and swelling. While highly effective for managing everything from mild headaches to chronic inflammatory conditions, NSAIDs can pose risks to kidney health, especially when used frequently or in high doses. The risk arises because NSAIDs reduce the production of certain chemicals that help keep the blood vessels in the kidneys dilated. Normally, these chemicals ensure adequate blood flow within the kidneys. When their production is inhibited, it can lead to decreased blood flow, impairing kidney function over time. This effect is particularly concerning for individuals who already have compromised kidney function or other risk factors such as dehydration or high blood pressure. Chronic use of NSAIDs can lead to more severe kidney damage, including acute kidney injury or even chronic kidney disease. Therefore, it's essential for individuals using NSAIDs, especially on a regular basis, to monitor their kidney function and discuss potential risks with their healthcare provider. NSAIDs, when used chronically or in high doses, can lead to kidney damage through several mechanisms. Primarily, these medications decrease the production of prostaglandins, which are compounds that play a crucial role in keeping the blood vessels in the kidneys dilated. Prostaglandins help maintain adequate blood flow and ensure proper filtration in the kidneys. When NSAIDs inhibit prostaglandin production, it can result in constricted blood vessels within the kidneys, reducing blood flow and diminishing the kidney's ability to filter blood effectively. This reduction in kidney function can lead to a condition known as acute kidney injury, AKI, characterized by a sudden drop in kidney performance. In some cases, particularly with long-term use or high doses of NSAIDs, this can progress to chronic kidney disease, CKD, where the decline in kidney function becomes gradual and irreversible. Furthermore, NSAIDs can cause salt and water retention, leading to increased blood pressure and further strain on the kidneys. This exacerbates the risk and potential severity of kidney damage. Given these risks, it is vital for individuals who rely on NSAIDs for pain management, especially those with existing kidney issues or other risk factors like hypertension, to consult healthcare professionals. This consultation can help manage the dosage and frequency of NSAID use to minimize kidney-related risks while still providing effective pain relief. Regular monitoring of kidney function through blood tests and urine analysis is often recommended to catch any signs of impairment early and adjust treatment as necessary. ACE inhibitors, such as lisinopril and enalapril, are a class of medications commonly prescribed to treat high blood pressure and heart failure. They function by blocking the action of a natural chemical that narrows blood vessels, which helps to relax and widen blood vessels, thereby lowering blood pressure. While ACE inhibitors are effective in managing cardiovascular conditions and can even provide protective benefits for the kidneys in certain scenarios, they also have the potential to cause kidney damage under specific circumstances. This potential for kidney damage mainly occurs because ACE inhibitors can decrease the pressure in the glomeruli, the kidney's filtering units. This reduction in pressure is generally beneficial for patients with high blood pressure or diabetes as it reduces the strain on the kidneys. However, in some situations, particularly where blood pressure or blood flow to the kidneys is already compromised, further lowering of this pressure can lead to inadequate filtration. This can cause an accumulation of waste products in the body, potentially leading to acute kidney injury. Moreover, for patients who have significant stenosis, narrowing of the arteries that supply blood to the kidneys, using ACE inhibitors can worsen kidney function. This is because the medications further reduce the already limited blood flow to the kidneys, exacerbating kidney issues. Therefore, while ACE inhibitors are beneficial for many individuals, it is crucial for those with pre-existing kidney conditions or those at risk of renal artery stenosis to be closely monitored by healthcare providers while on these medications. Regular kidney function tests are often recommended to ensure that the kidneys are responding well to the treatment and not experiencing adverse effects. ACE inhibitors, while beneficial for controlling high blood pressure and managing heart conditions, carry a particular risk of causing kidney damage in patients with existing kidney issues. This is primarily due to their mechanism of lowering blood pressure, which, while generally helpful, can reduce the blood flow to the kidneys too much in certain circumstances. For patients whose kidney function is already compromised, any further reduction in kidney blood flow can lead to a decrease in the filtration rate. This reduction makes it challenging for the kidneys to clear waste from the blood effectively. Additionally, patients with renal artery stenosis, a condition where the arteries that supply blood to the kidneys are narrowed, face increased risks when using ACE inhibitors. In such cases, the decreased pressure caused by these drugs can lead to an insufficient blood supply to the already narrowed arteries, exacerbating the risk of acute kidney failure. Therefore, for individuals with known kidney impairments or conditions that predispose them to reduced renal blood flow, the use of ACE inhibitors must be managed very cautiously. Healthcare providers typically recommend regular monitoring of kidney function through tests like serum creatinine and blood urea nitrogen levels to assess how well the kidneys are functioning under the influence of these medications. Adjustments in dosage or even switching to alternative treatments might be necessary based on the results of these tests to prevent further kidney damage while managing the primary health condition effectively. Antibiotics such as vancomycin and gentamicin are powerful tools in treating bacterial infections, but they must be used with caution due to their potential nephrotoxic effects. These antibiotics can be particularly harmful to the kidneys when administered in high doses or overextended periods, especially in patients who already have compromised kidney function. Vancomycin is known for treating serious, life-threatening infections caused by gram-positive bacteria, including MRSA, methicillin-resistant Staphylococcus aureus. While effective, it has a narrow therapeutic index, meaning the range between an effective dose and a toxic dose is very small. Kidney damage can occur if blood levels of the drug are not carefully monitored and adjusted, particularly in patients with pre-existing kidney issues or those receiving other nephrotoxic drugs. Gentamicin, an aminoglycoside antibiotic, is used to treat severe infections caused by gram-negative bacteria. Like vancomycin, its efficacy comes at the risk of nephrotoxicity. Gentamicin can accumulate in the renal cortex, leading to acute kidney injury. The risk increases with higher doses or prolonged therapy and is compounded in elderly patients or those with pre-existing renal impairment. In clinical settings, it is crucial to monitor kidney function regularly when patients are treated with these antibiotics. This often involves checking serum creatinine levels to assess kidney function before, during, and after the course of treatment. Adjusting dosages based on kidney function and overall patient health can help mitigate the risk of renal damage. Additionally, ensuring adequate hydration and avoiding concurrent use of other nephrotoxic agents can also help reduce the likelihood of kidney injury. Certain antibiotics, notably those like vancomycin and gentamicin, carry a risk of nephrotoxicity, meaning they can potentially cause kidney damage. This risk arises because these antibiotics can accumulate in the kidneys, where they exert toxic effects on renal cells, particularly in the tubules and glomeruli, the main structures involved in filtering blood. The nephrotoxic potential of these drugs necessitates careful monitoring when they are administered, especially in vulnerable populations such as the elderly, those with pre-existing kidney conditions, or patients who are concurrently taking other nephrotoxic medications. The importance of monitoring kidney function when prescribing nephrotoxic antibiotics cannot be overstated. Regular assessment of kidney function, typically through blood tests measuring serum creatinine levels and calculating estimated glomerular filtration rate, eGFR, helps in identifying any early signs of kidney impairment. This monitoring allows healthcare providers to adjust dosages promptly or switch to less harmful medications as needed to prevent permanent kidney damage. Additionally, therapeutic drug monitoring, TDM, is often employed with antibiotics like vancomycin. TDM involves measuring drug concentrations in the blood at specified intervals to ensure that they remain within a therapeutic range that is effective yet not toxic. Maintaining drug levels within this narrow therapeutic window is crucial to maximizing efficacy while minimizing the risk of adverse effects, including nephrotoxicity. Such vigilant monitoring strategies are integral in mitigating the risks associated with nephrotoxic antibiotics, ensuring that treatment of severe infections does not compromise kidney health. This approach underscores the delicate balance required in antibiotic therapy, where the benefits of infection control must be weighed against the potential risks to other vital organs like the kidneys. Diuretics such as furosemide and hydrochlorothiazide are commonly prescribed to help the body eliminate excess fluid by increasing urine production. They are frequently used to treat conditions like hypertension, heart failure, and edema. While these medications are highly effective in managing fluid balance and reducing pressure on the cardiovascular system, they also come with potential risks, particularly dehydration and kidney overload. Dehydration is a significant risk because diuretics expel water from the body, which can lead to a decrease in blood volume. This reduction can cause the blood to thicken, increasing the risk of clotting and reducing the efficiency of the kidney's filtration process. If not carefully managed, this can strain the kidneys, leading to potential damage or exacerbation of existing kidney conditions. Moreover, the increased workload on the kidneys to filter and expel the excess fluid can lead to what is termed kidney overload. This condition occurs when the kidneys are forced to work harder than usual for extended periods, potentially leading to wear and stress on these organs. Over time, this can decrease kidney function and may contribute to the development of chronic kidney disease, particularly in individuals who are already at risk due to underlying health conditions. To mitigate these risks, it is crucial for individuals taking diuretics to maintain proper hydration by monitoring fluid intake and observing any signs of dehydration, such as decreased urine output, dry mouth, and dizziness. Regular monitoring of kidney function through blood tests can help detect any signs of kidney stress early. Additionally, healthcare providers might adjust the dosage or type of diuretic used to balance the benefits of reducing fluid overload with the potential risks to kidney health. This careful management is essential to prevent long-term damage to the kidneys while effectively treating the underlying health issues. Proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are widely used to reduce stomach acid production, treating conditions like gastroesophageal reflux disease, GERD, stomach ulcers, and Zollinger-Ellison syndrome. These medications are highly effective in managing acid-related symptoms and promoting healing of the gastrointestinal tract. However, recent studies have raised concerns about the long-term use of PPIs and their potential link to kidney disease. Research indicates that prolonged use of PPIs may be associated with an increased risk of chronic kidney disease, CKD. One proposed mechanism is that PPIs can cause acute interstitial nephritis, an inflammatory process in the kidneys that can reduce their ability to filter waste from the blood. Although this condition is reversible when diagnosed early and the medication is stopped, undetected or persistent inflammation can lead to more permanent kidney damage. Additionally, the long-term suppression of stomach acid by PPIs may interfere with the absorption of certain minerals and vitamins, such as magnesium, which is crucial for various bodily functions, including the normal operation of the kidneys. A deficiency in these nutrients may contribute indirectly to kidney dysfunction. Given these risks, it is crucial for patients using PPIs, particularly over an extended period, to have regular monitoring of their kidney function. Healthcare providers often recommend routine blood tests to check for early signs of kidney impairment and may discuss alternative treatments if there are concerns about kidney health. This proactive approach helps ensure that the benefits of controlling acid-related symptoms continue to outweigh the potential risks associated with PPI use. Chemotherapy drugs, such as cisplatin and methotrexate, are crucial in the treatment of various cancers, playing a vital role in reducing tumor size, killing cancer cells, and improving survival rates. Despite their effectiveness in oncology, these drugs are also associated with significant risks to kidney health, which must be carefully managed. Cisplatin is known for its efficacy in treating cancers such as testicular, ovarian, and bladder cancer, among others. However, it can be highly nephrotoxic, potentially causing damage to the cells in the kidneys that filter blood. This damage can impair the kidney's ability to remove waste and regulate fluid and electrolyte balances, leading to various degrees of kidney dysfunction. The nephrotoxic effects of cisplatin are dose-dependent and can accumulate over the course of treatment, making it crucial to monitor kidney function closely during therapy. Methotrexate, used in the treatment of certain types of cancer as well as autoimmune diseases like rheumatoid arthritis, can also negatively impact kidney function. It is primarily excreted by the kidneys, and high doses or reduced renal clearance can lead to an accumulation of the drug, exacerbating its toxic effects on the kidney tissues. In severe cases, this can lead to acute kidney injury. The management of patients receiving these chemotherapy drugs typically involves pre-treatment assessment of kidney function, hydration protocols to help flush the kidneys and reduce drug concentration, and regular monitoring of kidney function during the treatment course. Adjustments to the dosage or the use of alternative therapies may be necessary if significant kidney impairment is detected. Despite these risks, the benefits of using these potent drugs in cancer treatment are substantial, and with careful management, the risk to kidney health can be minimized, allowing patients to receive the life-saving treatment they need. Antiviral drugs such as acyclovir and tenofovir are critical in managing viral infections, including herpes, simplex, varicella zoster, and HIV. While these medications are effective in controlling viral replication and reducing the severity of infections, they can also have nephrotoxic effects, particularly when not used carefully. Acyclovir is commonly used to treat and prevent outbreaks of viral infections such as shingles, chickenpox, and herpes simplex. However, it can accumulate in the renal tubules if not adequately excreted, potentially leading to crystalluria, crystal formation in urine, and subsequent kidney damage. This is particularly a risk in patients who are dehydrated or already have compromised kidney function. Tenofovir, especially in its earlier formulations such as tenofovir disoproxil fumarate, TDF, is known to cause kidney issues, including acute and chronic kidney injury. The drug can affect the proximal renal tubules, leading to a reduction in their function, which may manifest as a decrease in phosphate absorption, glycosuria, sugar in urine without high blood sugar levels, and proteinuria, protein in urine. The potential nephrotoxic effects of these antiviral drugs underscore the importance of dosage management. Careful consideration of the patient's existing kidney function is essential before prescribing these drugs. Dosage adjustments based on kidney function can help minimize the risk of renal damage. Regular monitoring, including blood tests and urine analysis, is also crucial to detect any early signs of kidney impairment. This allows for timely interventions, such as adjusting the drug dosage or switching to a less nephrotoxic alternative to prevent permanent kidney damage while continuing to manage the viral infection effectively. Overall, while the antiviral efficacy of these drugs is invaluable, ensuring their safe use through proper dosage management and regular kidney function monitoring is essential for protecting patients' renal health. In conclusion, we've discussed a range of medications that, while effective for treating various health conditions, carry potential risks to kidney health. These include NSAIDs like ibuprofen and naproxen, ACE inhibitors such as lisinopril and enalapril, antibiotics like vancomycin and gentamicin, diuretics including furosemide and hydrochlorothiazide, proton pump inhibitors like omeprazole and esomeprazole, chemotherapy drugs such as cisplatin and methotrexate, and antiviral drugs like acyclovir and tenofovir. Each of these medications can impact kidney function, especially when not used with caution or monitored appropriately. To safeguard against potential kidney damage, it is essential to undergo regular kidney function tests if you are using any of these medications. These tests help detect early signs of kidney stress or damage, allowing for timely interventions that can prevent more severe complications. Additionally, always consult with healthcare providers to ensure that any medication is used safely according to your specific health needs and conditions. We encourage all viewers to discuss any concerns about their medications with their doctors, ensuring they fully understand the risks and benefits. If you have experiences or further questions, please share them in the comments section below. We're here to foster a community of informed individuals taking proactive steps towards better health. Thank you for watching this video. Remember, being well informed about the medications you take and understanding their effects on your body, particularly your kidneys, are crucial steps in managing your health effectively. Stay healthy, stay informed, and take care of your kidneys.